well, since we're group 3, and we'll be presenting on the nurse theorist, Virginia Avenel Henderson. So she was born on November 30th, 1897 in Kansas City, Missouri. If she was still with us today, she would be 113 years old. So my group and I would like to recognize her and ask y'all to join us in happy birthday. We're going to ask Michael to start for us.
Okay, ready? 1, 2, 3, go.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Virginia. Happy birthday to you.
All right, thanks. That was grade 12. Back to the beginning. She graduated in 1921 from the Army School of Nursing in Washington, D.C. In her early years, she spent her time working in the community as a visiting nurse. That's very similar to our home health nurses today. After a few years of working in the community, she decided to return to school, and she earned her bachelor's and master's degrees at the Columbia University. She also decided to go back and teach, and she also taught at Columbia. And in 1953, she decided to be a nurse researcher. And she did her researching at the Yale University School of Nursing. Henderson explored many aspects of nursing, and that I want to do, as I'm sure many of you want to do as well. She went through the military school, also did the community nursing, and went back, continued her education, and also decided to be a nurse researcher. And I think she is a great example of the endless possibilities that we have as nurses.
Her education and accomplishments include that she's been called the Florence Nightingale of the 20th century, and she's also been called the First Lady of Nursing. She was an early advocate for inclusion of psychiatric nursing in the nursing curriculum. The Sigma Theta Tau International Nursing Library is named in her honor, and her research at Yale culminated in the publication of the 4-volume Nursing Studies Index, the first annotated index of nursing research. She believed her Nursing Studies Index to be the most important work that she had done, and she pointed out that until the average practicing nurse learns how to use and will use indexes to retrieve information from data banks, the nurse will not have taken the most elementary step to becoming part of a research-based profession. Any researcher who does not find, review, and build on related research is busy rediscovering the wheel, wasting time and usually someone else's money.
Okay. Ms. Henderson was a humanist, thank you. She viewed education as the core and the root of nursing. She just thought that it was really important to educate your patients and educate the family. And I always remember Ms. Easton, like if I never had a diagnosis for microphone, she would always tell me, you can always do knowledge deficit, you can always educate. It's just, we have the advantage of knowing all this about, the disease process and pathway and stuff, and I just feel like that's a real big opportunity for us to help our patients better themselves. And her definition of nursing helped shape careers and the philosophies of many nurses to follow, which is the truth, because this is what she was born in 1897, and she had this definition of nursing and this outlook, and it's been carried on today because Ms. Easterling sitting there telling me, educate. And her definition of nursing was the unique function of the nurse is to assess the individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. That's really good.
Henderson's theory of nursing is relative to her definition of nursing. Her fundamental basis was to return a patient to an independent state through patient-focused care. Her theory outlines 14 basic necessities for effective nursing care. The first of these basic components is breathe normally. fourth is eat and drink adequately. Third is to eliminate bodily waste. The fourth is to move and maintain desirable postures. And then you must sleep and rest. Then select suitable clothing, dress and undress. Maintain body temperature within normal range by adjusting clothing and modifying the environment. Keep the body clean and well-groomed and protect the integrity. Avoid dangers in the environment and avoid injuring others. Communicate with others in expressing emotions, needs, fears, or opinions. Worship according to one's faith. Work in such a way that there is a sense of accomplishment. Play or participate in various forms of recreation. And finally, learn, discover, or satisfy the curiosity that leads to normal development and health, and use the available health facilities.
Okay, the major assumptions in Henderson's theory are pretty basic. One of the first ones is that until a patient can take care of themselves independently or until death, nursing care is needed. And this assumption is based on the individual's desire to get better as well as the nurse's willingness to help. And I think, and that's one of the requirements of being a nurse, is that you have a willingness to help your patients get better or to have a peaceful death. And then another assumption that is one of Henderson's theory, and it's also shared by other theorists, is that the nurse must be educated and be mentally and physically capable to perform all nursing skills in order to take care of their patients.
Okay. Because Henderson's theory involves, just pretty much the person as a whole, and getting them back to be independent so they can perform their ADLs and live as much on their own as they can. It's applied to all parts of nursing, being physiological, psychological, emotional, and sociological. The most part that it probably applies to would be the physiological field, though, and that's just because that's what you come into the hospital. You have physiological symptom hearing, you go to the hospital, get it checked out. So that's the most common reason for seeking care.
We have an application example, you have a young male admitted to the hospital with a history of current problems, weight loss, blurred vision, polyphagia, polyuria, generalized weakness, nausea, vomiting, delirium, brittle toenails, very little hair on the legs and feet, and lesions on feet and toes. The team of the healthcare providers diagnosed the patient with type 1 diabetes. With this theory, the nurse's role would be to help the patient regain a healthy, independent state by promoting specialized diet and exercise. This could be eaten every 2 to 3 hours. 5 or 6 small meals are recommended with light exercise after meals to promote circulation and to prevent sugar spikes. Education on intensive foot and eye care, that could be to teach them to examine their feet daily, put moisturizer on their feet, cotton wool socks, eliminate obstacles, and cut toenails straight across. Eye care could be to get their annual dilated eye exams, teach correct techniques for measuring blood sugar, teach correct administration of insulin, help the patient with self-image disruption, and to teach coping skills for required lifestyle and redefined independence.
So just to kind of sum up, Henderson did not view her work as a theory necessarily, and she didn't expect everyone to agree with it. She really encouraged nurses and other people to develop their own theories and their own belief system and how their own way of practicing nursing, because not everybody's way of nursing is going to look exactly the same, but the different qualities of caring and nurturing, that should be the background of your nursing care, but how you go about that isn't going to look the same with everybody. And she recognized that and encouraged people to develop their own way of doing it. She died a peaceful death on March 19, 1996, and she lived out her definition of nursing. Others did for her, but she did not have the strength to do for herself. And this is our group.